with Dr. Benita Zahn.
As the number of COVID-19 cases explodes across the country, some say not such a big deal because death rates haven't spiked. But that's missing all the long-term effects of this disease that the survivors are facing. Infectious disease specialist Dr. Alan Sanders is Chief Medical Officer at St. Peter's Health Partners Acute Care, and he's our guest now. Hi there, Dr. Sanders.
Good morning. How are you doing, Benita?
Well, good. So far, I think everybody who's able to, I say vertical, getting a paycheck, you're ahead of the curve. But for those who are becoming, let me start with, more people are getting diagnosed, but there's fewer deaths. Is this a good thing, or is this a warning shot?
So I think we need to be understanding the dynamics of SARS-CoV-2 or COVID, in that there is a lag period between those who are diagnosed, appreciate the individuals who are being diagnosed in terms of their age and their comorbidities, and what will be an expected outcome in terms of death and morbidity in the weeks ahead. So, reflecting back on what happened in the Empire State back in March and April, we had a lot of people who weren't even diagnosed, and we had no idea how long they were even sick for before they landed in extremis in our emergency departments, ended up in our ICUs, intubated, and then had demise. We, later on in the month of April, as we had more people come in, we had people who were on ventilators for 2, 3, 4, 5 weeks, who may not have died necessarily early on in this situation, but they were intubated for a long time, finally got weaned off the ventilator, and have long-term morbidity after all this. So to say that the death rate's not going up today is not a true reflection of all the new cases that are being diagnosed. And what we already know there are very, very full ICUs in the state of Florida, in Texas, and now in California. Mm-hmm. These folks aren't doing great, and we can expect poor and potentially bad outcomes from them thereafter.
There's also literature, I'm bringing Coles to Newcastle, sharing this with you, but there's literature and a growing body of literature showing that there's long-term implications after you've ostensibly recovered from COVID or SARS-CoV-2. And they're very different issues for people. Can you help us understand that?
Yeah, sure. So, this is a very nuanced viral infection. There are a lot of complications that come up out of this that we don't see with influenza or other severe viral respiratory infections, such as blood clots, people suffering strokes, people having other blood clots in parts of their body that lead to organ dysfunction. A lot of the damage that's going on in the lungs is due to very small blood vessels that are getting clotted during the high inflammatory phase of COVID. And that will lead to long-term sequelae for those people from a respiratory standpoint. They will suffer diseases that we haven't reckoned with before, mm-hmm. In terms of chronic pulmonary conditions. And it's only July. Our peak was April 9th and 10th. So people are going to be suffering with long-term consequences of their lungs. Some people have ended up on dialysis machines because of their illness, survived the illness, but remain on dialysis hereafter. Some people have suffered cardiac manifestations. Again, people have suffered vascular blood vessel issues where they've had strokes, some of them very debilitating, even in young people. So multi-organ systems have been involved, even in the people who have survived this infection, and we won't know all of it for a number of months, if not years.
Young people, they think they're bulletproof. Yep. They always think they're bulletproof. Are they when it comes to COVID-19?
They are not bulletproof. There are tragic stories of people who are young without any significant comorbidities who have succumbed to this illness. We are getting better about treating people who are critically ill with new modalities. So we've heard about remdesivir, the antiviral medication. It's not a game changer in terms of mortality, but it appears that dexamethasone, a very common corticosteroid, has become a game changer, and everybody's using it now in terms of people who are requiring oxygen in the hospital. We know that hydroxychloroquine wasn't a game changer. So we're getting better at treating these people. But young people are ending up in ICUs around the country right now. Yeah, most of the time they don't do poorly, but a lot of times they do.
So what should we be looking at? You know, we still have a lot of summer ahead of us. There's vacations that are planned. Should we go? Should we do these things? Give us some direction here.
I mean, I think if you take our lead as individuals in the state of New York, there's a reason why we came down from our apex in mid-April pretty quickly. I think we behaved wisely, especially in this region. I would say to people we have, I think, a nice balanced mixture of Metro New York level of anxiety and neurosis and upstate New York obedience that kept us wearing masks, kept us separated from each other. And I don't know of any other formula other than strict hand washing, wearing a mask in public, keeping 6 feet away from individuals, and really avoiding crowds as best as possible as an ongoing effort to contain this virus and keep you from getting infected. There's clearly an issue with crowds, indoor crowds, especially in air conditioning with all the turbulence that air conditioning causes inside. So that is, trying to keep away from crowded venues, entertainment venues, bars, restaurants, as best as possible. Wearing a mask when you're in places like that, you have to. There's no vaccine. There's not a great preventive at this point. So I just think ongoing compliance, hand washing, masking, and social distancing has to keep going until we get to the point where we have a vaccination.
And before I let you go, look, you know that there's tremendous pushback to wearing a mask. Don't tread on me. These are my rights. It's not healthy for me to wear a mask. You've heard it all. So how do you get through to that portion of the community that scoffs, thinks it's a joke, thinks this is still a hoax?
Yeah, I don't know how to get through to people other than the proof is in what we did in the Northeast and the most early affected states that had this. It wasn't because the virus ran through and infected so many people, even asymptomatically, that we have huge herd immunity around here. We don't. We're in the low single-digit numbers in terms of people who actually have been infected and have immunity for it now. So it's not because we had a huge impact and therefore we're doing great right now because we have herd immunity right here. We did well because we abided by the governor's executive orders and edicts and pleas to wear a mask, be distanced from people, wash your hands, and stay away from any large crowds.
Yeah.
It just makes sense. Nothing else. There's no other formula right now.
Right now, no magic.
Enigmatic virus.
And that's part of the problem, that because things have changed so much, a lot of people feel that we don't, medicine, science doesn't really have a handle on it and doesn't know what they're saying because things are changing, so it's hard for them to follow. But that's science,
exactly.
I guess.
Yeah, it's exactly. I mean, you have to follow the science. I hate to think that the Enlightenment is on trial in all this. John Meacham mentioned that. I think that science has to lead, and physicians who are speaking out about this have to lead. I think Dr. Fauci yesterday mentioning the false narrative, quote unquote, about the low or the unexpected low death rate isn't the story right now. What the story is the full ICUs around the country, the pressure upon PPE around the country, the feeling that one can travel without harm. It's just not correct. I think you asked before what you do about vacation plans. I think you need to do what, I'm not trying to stand like the pillar of the community here, but what me and my family are doing. You just don't go anywhere for now. I mean, it's just not a safe adventure. Jump onto an airplane and go to a state that may not be on the watch list right now, but it may be tomorrow. So we have to just tune it down for a while still.
Dr. Alan Sanders, St. Peter's Health Partners Acute Care. Thanks so very much. I hope we get a chance to continue the conversation. I could probably talk to you for an hour. I know that the audience would say, I've got another question. Stay well. Thanks. Thank you very, very much.
Thank you, too. Bye-bye.
And thank you all for joining us. And all the programs that we've done on COVID can be found right here at WNYT.com. We'll see you next time.